I'm Brad, and probably the last 2 years, I've always been into fitness. I've done a lot of weightlifting. I'm into yoga, and probably within the last 2 years, I started experiencing some hip pain, and assumed it was arthritic, but wasn't sure. And so finally, about a year ago, was the first time I really sought some, other than doing some traditional therapy, which was helping a little bit, but not really. Anytime I tried to load my hips with a heavier weight, I was still having the pain. And then it got to the point where I wasn't sleeping. And that's when I knew, I was like, yeah, something's not right. So I started with cortisone injections, and sure enough, I got some relief. It lasted for a little while, and then I backed off on activity. So those helped, but then when I started to introduce the activity again, I was kind of right back where I was at. I was still in pretty good shape and young, that I'd rather get new hips now than down the road, and I also want to get back to the lifestyle that I was living. So I was very motivated if I was going to have this procedure to want to do it on an outpatient basis. And in Iowa, there really just wasn't that many choices. I did hear, before I met Dr. Cagle, I heard of a guy in Iowa City area, and then the therapy clinic that I work out at in the TBK, we actually got a visit by Dr. Cagle. And he was just out trying to get his name out and shaking hands, and explained to me kind of what his specialty was, and I was telling him, interesting because of my hip problems that I was having, and he was explaining his technique, and again, it was outpatient, and all those things were, and he's right here in my backyard. So I basically just waited for him to become a Blue Cross Blue Shield provider, and I set up my appointment, and so within a couple months of meeting him, I had my surgery, which was on June 30th. The surgery, the other thing that was nice about Dr. Cagle was prior to the surgery, you sit down with him and he gives you a very detailed book that describes everything from that day to the day of the surgery and the anticipation of what to expect after the day of surgery. And that's just to keep you as comfortable as possible and as functional as possible. And it's very detailed. I've never seen anything like that before, and I've been a practicing therapist for 30 years. Actual day of, everything went, of course you're nervous and scared, it's normal, but the experience was fine. The staff at the Mississippi Valley Surgery Center were phenomenal. My surgery, I think my surgery started at 8:15, and I was back in the room at 10:19, but within several hours, I was already standing in a walker and able to walk the halls, and I was even able to walk steps, which were some things they wanted to make sure I could do safely before they were going to discharge me. So by 3 o'clock that afternoon, I was in my car heading home.
You don't have to be staying a week in the hospital anymore and then going to a rehab facility. We've actually learned that it's actually safer to go home and re-enter your life and get out of that sick mode mentality.
Yeah, we're 15 days. So I was able to go back to work as a therapist just a week after my surgery. I did use a walker for the first day, but the facility that I'm in is huge, and there's a lot of stairs. And I was able to, even that first day, I was up and down stairs quite a bit. In fact, I probably was on it probably more than I should have been. But, I iced it and elevated it when I felt the need, and that always would take care of the symptoms. But yeah, I was back to work. 15 days out now. I was just telling Dr. Cagle that I've noticed that you have some quad pain obviously, and you have some inflammation in your hip area or the incision area, but that is dissipating daily, and I'm walking, more, without so much of a limp toward the end of the day, you're tired, when you're on your feet all day long. But for the most part, there's a difference between feeling fatigue and pain, and I really don't feel the pain, and I'm not managing my pain anymore with medications. I'm just managing it with ice.
Yeah, and how is it interacting with patients now, kind of, after having hip replacement? And because that's a demanding job, I would assume.
It's gone well. I'm able to perform every component of my job. And that's even taking patients up to a huge gym upstairs, adjusting the weights and the weight machines for them. And then, if I need to, I can sit down. So periodically, I'll sit down, but I would say 75% of my day, I'm on my feet.
But thinking of the future, so what lays on the horizon moving down the road?
Yeah, so the encouraging thing for me is, I chose the left hip, but the right one's pretty bad as well. So I've scheduled a second surgery with Dr. Cagle on September 1st. And the reason I just want to knock them out is I just want to get back to that quality of life. So, my objective is just to, want to continue to work for quite a while yet because I really enjoy what I do. I want to be able to go and do the things in the gym like I used to be able to do, but I kind of like to do it without any hip pain.
I always like to kind of end these interviews with, if you have any advice for people, who are unsure about what to do as far as finding a doctor, what kind of treatment's right for them, and they're contemplating, geez, what do I do because my hip or my knee hurts? What would you tell them?
Well, one of the things I would tell them is it's amazing what they can do in such a small incision these days. I have this Bikini Incision that's probably 4 or 5 inches long at most, which is another reason I really like the outpatient perspective, is that you're basically getting away from cookies. If you're getting back home, I would tell people that outpatient is the way to go. It's just, they're not trying to kick you out. Nobody's going to let you leave until you're ready to leave. But it just comes so far, when people aren't getting startup like they used to, and it's incredible how mobile you are, so quickly. So I guess I would just say that the whole experience of the outpatient experience was extremely favorable, and as a therapist, I am anxious to direct people your way.
Well, I appreciate that. Thank you so much. I know it's always, especially when people refer their friends or family, or if you're in the healthcare world, and you have any number of people that you can call to be your doctor. So it's always a badge of honor, when people do that. So I really appreciate it. And thank you for your trust, and glad things are going so well. And like I said, it's my privilege and honor to work with you.